Morning, everyone, and thank you for joining us in what I expect will be a highly informative 1 hour, where with the help of such experts as Janice Hogan, Lowry Barnes, Mark Viscogliosi, Michael Mogul, and two of the top medical technology analysts on Wall Street, Mike Matson and Shagun Singh, we will review what the hell happened in 2020, articulate what lessons were learned, and ask these experts to share their outlook for 2021. I do not think it's an exaggeration to say that our best laid plans, for 2020, which 1 year ago we were all in the process of implementing, were pretty much blown apart, first by COVID, then delayed surgeries, and finally the overwhelming costs of treating 25 million COVID patients, which pushed many hospitals to the financial brink and caused sharp revenue declines across the board for suppliers and other companies. 2020 was a major stress test for our orthopedic and spine community. Did 2020 change us? And if so, how and how permanent are those changes? Will 2021 begin the process of regressing to the mean, or did the events of 2020 accelerate certain underlying trends, ASCs perhaps? And will we be adjusting to some form of new normal? To answer these questions, I assembled a truly outstanding master faculty. I cannot wait to hear what they have to say. Before we begin, I'd like to remind everyone to please use the Q&A function down below. As the speakers are presenting their comments, don't hesitate to type your questions as they occur to you. Once all the speakers are finished, we'll have a 20-minute Q&A session, and I'll be reading your questions and presenting them to the faculty. We'll wind up our call exactly 1 hour after we started today. Finally, this is being recorded and I'll be posting it on the Orthopedics This Week website next week. Again, thank you. I'm delighted that each of you is here, and let's get started. I asked Michael Mogul to kick off our meeting today. Mike is President and Managing Director of HealthPoint Capital. Before that, he was President, Chief Executive Officer, and Director of the billion-dollar DJO Global Company. And before DJO, Mike was Stryker's Group President for Global Orthopaedics, itself a $3 billion business. For more than 3 decades, Mike has been a builder and a leader, and I cannot think of a better person to start us off. Mike, thank you for agreeing to speak today.
Thanks, Robin. It's great to be here. 1 year ago today, January 15th, 2020, the New York Times headline was the Senate being impaneled for the impeachment of Donald Trump. Yes, that was actually in 2020, unbelievably 1 year ago today. The Wall Street Journal actually had an article that said for the first time in 25 years, Americans drank less wine than the prior year. That trend definitely did not continue in 2020, at least not in our house. And modern healthcare, the cover of Modern Healthcare described the challenges of hiring and retaining long-term care facility workers. And obviously that got a lot harder during the course of the year. So as Robin asked us to think about how 2020 will impact 2021, realizing the massive misses people had in forecasting the year of the really big events of the year, and obviously step into this with trepidation, but see 3 major trends that did happen in 2020 and will specifically impact 2021. First is in procedures. Obviously, April was a horrible month and procedures dropped by 70 or 80% in orthopedics. But what was amazing to all of us was how fast they bounced back. And although even in Q3, you saw hospitals down 7% in inpatient procedures, 6%, 5% in outpatient procedures, we saw in orthopedics a much, much stronger rest of year than we expected. But it really did move more and more rapidly towards same-day surgery than we had ever seen before. And we've been talking about ASCs and the move of the ASCs and elective procedures for 3 or 4 years now. It moved rapidly. What was also surprising was to see hospitals starting to do same-day surgery in their operating rooms. They don't have beds, but they have operating rooms that they can use, and patients are coming in and going out. So we'll see this move to same-day surgery happening at a much faster pace in 2021, and the opportunities will be surrounding it. The ASCs are not prepared for it. still need lots of equipment, systems, logistics, and the patients going home same day is going to continue to create lots of opportunities for trying to take care of those patients and tracking those patients post-operatively. So we expect, and I'll talk more about how I think procedures will be impacted by hospitals and payers here in a second. Second major trend we saw in 2020 that will carry forward big time in 2021 is that the future really is digital. We've been looking at digital healthcare companies nonstop every week for the last years, and always wondering when it was going to come. It really came, fiercely in 2020. 1 year ago, less than 1% of medical encounters were via telehealth. By April, it was 37%. Sat in the 20s in the summertime, and since August has been at a steady 15% of medical encounters are now in telehealth. And so this is a sea change that we will really feel here in the years to come. But at the same time, we know that orthopedics is a practice, a specialty that involves a lot of hands-on. And although you can talk to your patients post-operatively via telehealth and maybe look at a wound, actually taking care of them is still a hands-on activity. And therein lies really some of the big opportunities in digital health we'll start to see play out in 2021 and beyond, because there need to be ways to actively interact with those patients and take care of what was a hands-on activity. And lots of neat companies out there with ideas to make that happen. The one area in digital health that did get impacted significantly in 2020 and will continue in 2021 was physical therapy. As we see more and more physical therapy being outsourced to digital at-home therapy, which obviously is not good for the therapist, is reducing clinic visits, but also reducing costs significantly. The last trend we saw this past year that will have an impact going forward is that small and medium-sized growth companies really got hurt by the cash crunch that occurred in the year. Procedures went down and financing went down. Most of these high growth companies don't operate on many months of capital, and raising capital got very different. A procedure drop really impacts them greatly. And the PPP loans helped, but then they dried up. And what we see is a lot of really interesting, neat companies out there with great technology, but really struggling because of the cash crunch. And this will, of course, be an opportunity in the year to come. 2021 see two additional vectors impacting the market. We're all waiting for this big group of patients that were held off, and this big glut of patients coming in 2021. But at the same time, hospitals had a really rough year, and their focus on downward pressure on pricing will be severe. And that'll be especially in the high volume procedures like total joints. And we expect to see a lot of this. They were also very effective in this past year at holding off new innovation, holding off small companies, building moats around their hospital. We can't have anybody in here because of COVID. And our smaller companies really felt that that more difficult chance to get into the hospital. And hospitals will continue to play that out as they're trying to control costs. The other part of this is the payers themselves. The payers had an incredible roller coaster year. In Q2 and Q3, you had payers with over 100% increases. This is United Healthcare, this is Anthem, this is Cigna, with over 100% increases in operating income, over 50% increases in cash on hand. So wild year for the payers. And although they give some of it back as the year continues on, those business leaders are not going to want an elective surgery free-for-all in 2021 because the comparables will be very, very painful. And so we expect to see downward pressure on elective procedures from the payers as they see those comparables going into the following year. To counter all that, and really my last point, is that innovation, however, really does count. And we saw in the midst of the summertime of COVID, companies with innovative products continue to get in the hospital, get in the operating room, be actively used, and those companies see tremendous growth in the middle of COVID. Because it hasn't changed. Innovation still drives this space. New products that really make a difference, both clinically and economically, will drive growth in the business. And that was a kind of the exciting part of what I saw in 2020. Innovation still does count, and I expect it to be big time important in 2021. Because the secret sauce for the large companies in this space, what makes them grow so well over time, are not their big product lines. It's actually, the big product lines provide the cash. It's the fleet of small businesses and small products that are growing rapidly that provide the growth for the big companies that have been successful. And those companies are hungry for continued growth. And so those small companies that were cash strapped in 2020 that have great innovation with help and support can really provide a continuing series of growth entities into these large companies. And that's not only what will help those large companies grow, be an opportunity for the small ones, but frankly, it's the most fun part of the industry. Seeing these small companies really develop, seeing new procedures, new techniques, new technology flourish. And for me personally, that's where I love to spend my time, and will be spending my time all year. So my thoughts on 2021.
Mike, thank you, Mike. That's fantastic. That was terrific. Our next speaker is the professor and chair of the Department of Orthopedic Surgery at the University of Arkansas Medical Center, and in 2017 became the Carl L. Nelson Distinguished Chair of Orthopedic Surgery. He is Dr. Lowry Barnes and is one of the foremost joint replacement experts in the world, lectures internationally, has published more than 250 peer-reviewed articles, holds patents, designed products, and is currently the president of the American Association of Hip and Knee Surgeons. His medical degree is from UAMS. His training is from Harvard. 10 months ago, he participated in one of my webinars where we asked the question, how do we get back to conducting surgery in the era of COVID? And he gave one of the best presentations I've ever heard. Lowry, it's an honor to have you back. Thank you.
Thanks, Robin. It's so good to be here. It's not so good to have to follow Mike Mogul, though. Outstanding as always. You know, you say, what have we learned from 2020? For one thing, we've learned that this is a pretty resilient specialty. Orthopedics has adapted. We're adapting today, a new way to educate each other. While we did this some in the past, nothing like we started doing in 2020. At our organization, the American Association of Hip and Knee Surgeons, we took it a step further. As you know, we have a very large meeting every November in Dallas. So far, we were the first and certainly the largest group to have a medical meeting since this pandemic started. It was a different format, a hybrid approach. So we had some of our members in Dallas and some connected electronically, but it worked and our members liked it. Those who went enjoyed the meeting. Those who connected electronically enjoyed the meeting. And importantly, we collected all the data and it was a safe way to do it. So other organizations were able to learn from us. So we're learning that there are other ways to do business, not only in what we do on a day-to-day basis, taking care of patients, but what we do for continuing medical education as well. As Mike mentioned, telemedicine boomed. Most orthopedic surgeons, especially those of us who were 60, had never considered doing telemedicine. But all of a sudden we were doing it and found out we could do it with help. And our patients actually enjoy it. The thing that changed for me too is I didn't do too many in-person rounds in the hospital. At an academic center, the resident was rounding, we were connecting via the telephone with a video chat with a patient. The patients absolutely love it. They see me as being totally focused on them for the time that I'm talking to them on their telephone, and our feedback has been very good. And I've obviously, in addition to telemedicine, the biggest change for us has been the move to outpatient, which Mike also mentioned. We have been leaders in early discharge from the hospital. For more than 10 years, most of our patients have been going home the following day, at about 95% of those patients. And most of our revision hip surgery and revision knee surgery patients go home the next day also. But when the pandemic hit, things changed. Initially, we weren't doing any elective surgery here. And then as we got back to elective surgery, had another spike, we limited the number of patients who could be admitted to our hospital from the operating room each day. Those were, for us, it meant the complex revision surgeries. It meant the people we were doing primary hip or knee replacement for were now being discharged the same day. And people say, that's hard to do in an academic center in a rural state who's unprepared for such. I can tell you that we literally turned the switch on one day and started doing it. and it has worked beautifully. Patients are also resilient. We give patients the option: do you want to wait till after the pandemic where you can stay in the hospital overnight, or would you like to go ahead and have your surgery and go home, and do you have the care at home? And well over 90% of the patients chose to do so. Now, we've had some cancellations and delays because family members or patients having a positive COVID test or actually having COVID. And so that changes. Resilience, again, the same theme: schedules change, and then we work around it. So far, we've had no major issues with same-day care and being discharged the same day. That doesn't mean, however, that there are not challenges. The hospitals are significantly challenged by this. The difference in a payment for a DRG for an inpatient primary total joint versus outpatient discharge on the same day is significant in some locations and varies around the country. We presented on this last year. There is a difference from $500 at one hospital to $6,800 at another hospital for the difference or the delta between the pay. If you're at the 6,800 level, all of a sudden you've got a whole new set of issues to deal with. And we see that that's mainly our academic centers, because the DRGs for inpatient care have add-ons for academic teaching, disproportionate care, et cetera, and those are not included in the outpatient payment. So again, cost control, efficiency, and a whole different approach for what hospitals are used to doing. But for 2021, I remain very bullish. I think we're going to see that orthopedics will expand. We're seeing that people are, such as private equity, are very interested in what we are doing in orthopedics, not only from the device world, but once again from physician practices. We're going to see further growth of ASCs and procedures that can be done there. We're going to see that we'll develop more efficient models. Will it be disposable instruments? Will it be smaller pans, less instruments, more technology? Not really sure all the different avenues in which we'll do it, but certainly procedures are going to change and processes are going to change. And for the most part, I think we're going to see that patients like it, whether they're done in the hospital as an outpatient or as an ASC. Patients like going home and sleeping in their own bed, being cared for by their family members. And so we'll see more and more of that. I think we'll see less of bundled care. As you know, bundled care is something that has been the first wave of managed orthopedics. And as predicted, it was a race to the bottom. There's not a whole lot of savings left in that model now. So we said, what's next? Certainly we'll continue down that process to population management. Will it be something similar to what we previously referred to as capitated care in orthopedics? I think we'll look at the management of disease processes. There'll be surgeons who are now managing the disease process of a degenerative knee from start to finish. And I think we'll see hospitalization at home expand more, not so much in orthopedics, but maybe with some of the longer term issues. You say, what are the concerns for 2021? One of the concerns we have is that because patients have not sought medical care throughout this pandemic, that many of our patients may actually be sicker in 2021. And so that we have to make sure that we can plan for that. We need to continue to optimize our patients before surgery and make sure that we are prepared to give them the care that they need, because some of that care has not been performed in the last year. We may also see that our hospitals, while not busy with some of these procedures can be done as outpatients, are still quite busy taking care of patients with chronic diseases, with those chronic diseases having had a significant impact by COVID, and those diseases are now worse. So overall, I am bullish on the next year as always, and I look forward to hearing the other panelists today.
Wonderful. Thank you, Lowry.
Thanks, Robin.
Our next speaker is 1/3 of the leading merchant bank and family fund firm in the orthopedic and spine community, known as the V Brothers. Mark Viscogliosi, along with his brothers, has helped to direct By My Counting, more than $1 billion of investments into our community. But more than that, Mark is one of our community's most respected visionaries. He has invested in a wide range of orthopedic technologies, was a successful CEO, has driven necessary and groundbreaking innovation while others, including some of the largest firms in our industry, stood on the sidelines. And to top it all off, he and his brothers founded one of the major surgeon societies. It is my distinct pleasure to turn the program over to my good friend, Mark Viscogliosi. Mark?
Robin, thank you. And it is indeed a tall order to follow Mike and Lowry and precede Janice, Mike, and Shagan. I'm humbled to be on this panel and honored to be on this panel. You know, when I think about 2020 and the pandemic, the first thing that I think about is how humbling it was for all of us in many different ways, whether we experienced it personally or on a broader level, and the amount of empathy and resiliency that I think we saw in this healthcare ecosystem and in the orthopedic ecosystem was inspiring, awe-inspiring. And I think that provides the foundation for when I think about the future of where this industry is going and how it's going to get there. It starts with that resiliency and that mindset. And one of the things that 2020 reminded me of is that mindset's our most powerful weapon to combat, the fear, the uncertainty, the paralyzed decision-making that's happening around us. And I think with a bias towards innovation and a bias towards adaptability, I think we can overcome. And we've seen a lot of that. We've seen those bright lights emerge from the darkness and use as guideposts going forward. And it's been pretty powerful. For me, at a very macro level, gratitude, grit, and giving remain the most important G's in my vocabulary, especially when I look to where we should spend our energy and focus in 2021. I think about all of that framework around us. When I look at the strengths of what's emerged, I think about the bias towards innovation and the move towards outpatient surgery. Those two convergence factors have been phenomenal. When I think about the weaknesses, I do believe that we continue to be too fragmented as physician and provider groups, and the influence of payers to direct care is only growing on a daily basis. So I think we need to strengthen our activities there. When I look at some of the macro forces that are underway around us, boy, if there's one government agency that has stepped up in my mind, it was FDA in a very, very powerful way. For years, I think FDA was frowned upon as a bureaucratic organization. I think 2020 shed that image. And with the mission of public safety being at the front and foremost of their mind, that agency really stepped up. And there's an enormous amount of innovative thinking that's occurring within FDA's walls. And we're excited to see some of that. With CMS and private reimbursement, the need for evidence development continues to be a primary driver of activity to support the development and growth of new treatment algorithms and new treatment therapies for innovative products. As I look to the capital markets, the capital markets are leaning into innovation and they're leaning into commercial stage revenue growth. Those two things will never change. Investors want to support innovation and they want to support commercial stage revenue growth. Because those are the key drivers of value creation and everything that we do. When I look at M&A activity, I expect 2021 to continue to be a robust environment for big ortho and big neuromusculoskeletal to pursue tuck-in acquisitions. Why? Because that's what they need to drive their revenue growth, is the continued innovation that comes from the lifeblood of what this industry does. Where do I see that innovation? I see it in a few primary areas. One is the concept of therapeutic convergence, whether it's drug device interface changes, whether it's digital health tech enabled technologies, or even improving diagnostic aids. That's where I see a lot of opportunity for investment and innovation. When I look at smart tools, sophisticated navigation, and smart implants, all of that is driving towards predictable, enhanced patient outcomes. And I think that for the next 3 to 5 years, if you are not squarely in that target area, you're going to miss it. It has to really be leveraging artificial intelligence, machine learning, and all of the technology that's coming at us like a tsunami in terms of being able to make everything we do better. The last major area that I would say is regenerative medicine and all of the framing around not just cellular therapies, but enhanced pharmacotherapeutics that drive it. When I think about what excites me, obviously, COVID bringing the attention that it has brought and the stress has created new innovation pathways. I like that. I think that's a good thing. It's a healthy thing for where we need to go. What worries me about 2021, obviously, we're not done with the pandemic. And we can't predict when we're going to be done. I think 2020 taught us to get a little bit out of the crystal ball game and, to just be smart about planning and reacting to what you can't influence or control, but being well positioned for that. I think we have to continue to have that mindset in 2021, whether that's another 6 months of aggressive lockdown measures or economic activity stimulus. We'll see how that unfolds under the Biden administration. That leads me to the last point on the uncertain healthcare agenda. I mean, obviously, the Biden administration is going to have a different agenda than the Trump administration. What that exactly is, we don't know. What we do know is that there will be a continued emphasis on cost containment, access to care, and continued support of trying to drive innovation at every level of our healthcare ecosystem. Robin, thank you for the opportunity to make comments.
Thank you very much, Mark. Great. Our next speaker is the partner and co-director of the FDA medical device practice at Hogan Lovells. Janice Hogan is an internationally renowned expert in FDA device regulation. Her guidance on regulatory strategy, clinical study design, advisory panel proceedings, and tools to expedite product approval are frankly relied upon by the entire industry. Over the past quarter century since graduating from MIT, Janice Hogan has achieved a number of firsts, including the first successful FDA CMS parallel review project, first-in-class approvals for breast cancer, diabetes, obesity, spine surgery, and neurology devices, as well as a variety of drug device combination products. We are very honored to have Janice with us today. Thank you very much, Janice. The program is yours.
It's my pleasure to be here. It's great to be with this group. And I think what will be reassuring to folks is that maybe without talking to each other in advance, you're going to hear a lot of the same themes from me as from others. Picking right up from where Mark left off, what do we expect? My practice is laser focused on helping companies to get new medical technologies through the FDA. So what do we know? I think we all probably share a common expectation that the Biden administration will come back towards where we were under the Obama administration, but perhaps moderated to some extent. If we start with what we know already about the political appointees, obviously we have now at the HHS level someone who came from the pharma industry. And we know that the incoming HHS secretary, subject to confirmation, is a lawyer, Attorney General of the state of California. And so this doesn't tell us what the exact priorities may be, but there is obviously a distinct shift there with the leadership chosen for particular skills that serve the administration's likely priorities going forward. Mr. Becerra, as probably folks know, as Attorney as Attorney General, has certainly deep experience with health policy, but comes at it from a different legal perspective, antitrust cases being foremost among some recent activity. So we can infer from that that the environment and the climate for business may be different. I think, though, we do not expect such a radical transition towards more aggressive enforcement because it will be tempered by a desire to protect the economic recovery. And so at a 30,000 foot level, we expect that the FDA will not be as pro-business, that there will be more enforcement activity. But on the pre-market side, we think things will still be quite good. If I had to project over my whole career in this industry, going back to when I was in pharma, I would say the climate will be more similar to what it was under the Clinton administration, which is middling in terms of the level of business friendliness. A lot of people have been somewhat scared that Dr. Kessler was brought back to help with the vaccine program. I don't read that as a signal that we are going to go back to that kind of an FDA environment. If we drill down a little bit deeper, I divide the world into what does it take to get a product approved and what is the climate after it was approved. And so on the pre-market side for devices, we expect that in the coming years, we'll see continuing evolution of the 510(k) process. We will see a lot of emphasis and FDA resources thrown against the most innovative and impactful products. We already see this with the breakthrough designation program. Folks may have seen earlier this week continuing finalization of the rule that will give breakthrough designated devices 4 years of automatic coverage from CMS. And that has really driven in my practice an explosion in the number of companies seeking breakthrough designation. We are now filing these requests at the rate of a couple a week, and that's just our group. The FDA also announced a program similar to breakthrough. Breakthrough designation is, if you would say, a fast track program for products that may be more effective than the standard of care. The FDA also pushed out this week final guidance on the STEP program, which is for products that are safer potentially, but not necessarily more effective. Where else do I see the FDA placing priority in the next few years? You've already heard others talk about artificial intelligence and machine learning. As a barometer, my practice tends to follow money and where the investment is going. And conferring with my colleagues, I'd say probably 1 out of 4 new clients are in the AI and machine learning space right now. And then we'll continue to see recovery from the COVID backlog. The FDA, as Mark said, has done a Herculean job, but their submission volume this year was up by several thousand submissions. And with no appreciable increase in staff, there can be nothing but a backlog. Fortunately, in orthopedics, there was not as much of an impact, but still some impact with people siphoned off to help with COVID diagnostic test reviews, personal protective equipment, respiratory support. Just as a snapshot, by the summer, about 3 to 4 months into the COVID pandemic, just our one group had filed over 200 submissions for emergency use authorization. And we're just a drop in the bucket compared to the totality of what the FDA is seeing. So we're going to see the FDA come back from that. On the post-market side, we know, if you look at the numbers year in and year out, you can see a marked change in the amount of enforcement. If we take warning letters as a metric, and you look during the Obama years, you can see varying from 150 to 200 device warning letters per year compared to 30 or 40 during the Trump administration. That trend reversed itself when we went from the Bush administration to the Obama administration. We fully expect it's going to reverse itself again in a direction not favorable to our clients for the coming year. And so we expect this, when you put an attorney general at the helm, and we see this trend historically. So what do I say to my clients? Be careful, be extra careful. The FDA's entire field force now is parked and cannot do inspections. They have nothing to do but look at companies' websites. They have thousands of people without a full complement of work. And so we tell all our clients to be very careful in this environment when we expect a big inflection. And this too, on the post-market field inspection side, there is a huge backlog of 9 months and more worth of inspections that the FDA has been unable to do. So anyone who anticipates that they will need a pre-approval inspection, we're telling them to bake this into their plans because they will deal with a 9 to 12 month backlog. Okay. What else do we see? You know, when the HHS secretary turns over, of course, there may be a domino effect of other changes at senior levels. We expect to see continuing personnel changes in the FDA. There have already been several office directors who have turned over in the past couple of months. In orthopedics, we think it's not going to be as affected, but this happens with every administration. And frankly, people at the FDA are exhausted and some are burned out because of the COVID workload. On the submission side, in addition to evolution on the 510K side, we expect that once the FDA recovers a bit, they're going to take a good hard look at the de novo approval mechanism. It has not been going well. In fiscal year 2018, about half of all de novos that were filed ultimately failed. That's not the sign of an effective process that's maturing. And I think the FDA recognized that rework was needed and tuning of that process. But of course, there was no time to focus on that in light of COVID. So we see that as something that I would predict is going to get some scrutiny and some adjustment. And with the increasing stringency of requirements in Europe under the MDR and the need for more and more multinational data, we expect to see more multinational studies and increasing interest in the use of post-market data. And I'm not talking about old school casual registries, but more and more sophisticated use of post-market data. Thanks very much, Robin.
Janice, that was terrific. Thank you. Our final two speakers include leading Wall Street analysts who spend 60 to 80 hours per week poring over financial statements, SEC and patent filings, and interviewing managements to figure out where our industry is heading. Our first Wall Street analyst is Mike Matson, who over his 16 years has won numerous awards, including first for stock picking by Thomson Reuters, 2 awards for earning estimate accuracy, also from Thomson Reuters, and an award I also won when I was a Wall Street analyst, the Wall Street Journal's Best on the Street Award. Before Wall Street, Mike worked for Stryker's Orthopaedics and Endoscopy division in marketing and product development, and he holds a patent. Mike, thank you for breaking away this week, particularly since this is earnings season. And from your vantage point, what are your takeaways from last year and what do you expect for 2021?
Yeah, sure. So I'm going to give a little bit different perspective here. I'm going to put some numbers behind what I'm talking about. Let me start out first by putting up my disclosures. Basically, a summary here is that Needham & Company is an investment bank. We do help companies raise money. I'd say I don't own any of the stocks that I cover or even any medical device stocks. And then the final one really just shows that, I don't get paid directly for any of my recommendations, or the firm doesn't get paid directly for that. So with all that said, I'm going to kind of go through our forecasts here. But before I get to that, I just want to give more of a descriptive view of what happened in 2020. The way I look at it is there were really 4 phases that happened, and we're still in the midst of this. So the first phase was just this blanket shutdown that happened late in the first quarter. Hospitals were told to stop doing elective procedures across the board, in preparation for this wave of COVID patients. But what really ended up happening was lots of the country didn't see that wave of COVID patients, and the hospitals were just sitting there empty, losing a lot of money. And then Once things started to kind of ease back in some of the higher infection rate areas like New York City and other places, the hospitals were allowed to start to open back up, and that's sort of phase two. That started in the second quarter and into the third quarter. That was what I'd call the reopening, restarting phase. And we saw volumes pick up quite a bit in that period, and the growth of the industry and some of the companies. Phase three was kind of a return to some of these shutdowns, but I think everyone learned from phase one, which was this blanket shutdown, that the governments, the state, federal, and local governments are really leaving this more up to the individual hospitals now, which makes a lot more sense. So if the hospital's overwhelmed and their ICUs are getting full, then they can choose on their own to kind of throttle back their elective procedures. But for hospitals that are in areas that aren't being as affected or don't have the number of COVID patients in the facility, they can continue to do them. So we are seeing an impact from this kind of second wave, third wave, whatever you want to call it, but it seems to be a lot smaller than what happened back in the spring, mainly because of this selective closure that's happening. And then phase four is really kind of starting with the vaccine rollout, which I think started late in the fourth quarter. And this will really drive the return to normalization. COVID's never going to go away, but as most of the population hopefully gets vaccinated, the infection rate should really come under control. And that should allow, things to basically get back to where they were, in 2019. In terms of numbers, so this is our best estimate of where we ended up for growth rates on a quarterly basis. You can see the numbers there. I'm not going to read through them. But the point is, the nadir was really the second quarter, huge 30% decline. But impressively, we saw a return to about 1% growth. Now, this is growth of the actual, implant sales of the device companies. But there would be a pretty strong correlation to the actual procedure volumes, just because, with aside from pricing and mix, which is minimal in the grand scheme of things, it's mostly volume driven. So for the year, we think we're going to end up at about a 9% decline. The fourth quarter, this is based on what we're modeling for all the companies. We see about 1% growth, which would be in line with the third quarter. But we wouldn't be surprised to see it end up being down slightly worse than the third quarter. In terms of 2021, this is what we're modeling. We expect a return to very strong growth. A lot of this is just due to math, because given the comps that the companies are going to be lapping, they should see some really strong growth. So we see, 15% growth for the year, which is, pretty impressive. But when you consider what happened in 2021, it's not that crazy. Sorry, in 2020, it's not that crazy. And just to put this in context, so if you look at the dollar sales of the entire market, the market was, we estimate, $32.4 billion in 2019. That's going to drop to $29.3 billion in 2020. And then 2021, even with the 15% growth, it ends up at $33.9 billion, which is up about 5% from 2019. So I think basically everyone really needs to look at 2021 as compared to 2019 rather than 2020. And we should see some modest growth off of the 2019 levels, we hope at least. The key variables for our forecast for 2021 are really the vaccine rollout, which is already seems to be a bit behind what the government had been hoping for originally. The percentage of the population willing to be vaccinated, there's a shockingly high number of people out there that are, kind of scared or just afraid to get vaccinated. The impact of the patient backlog, clearly there is a backlog. We burned through some of that, I think, in the third quarter, but now with the fourth quarter slowdown, we're probably building up a new backlog. The health system capacity, and then patient sentiment, just the willingness to go back and to get an elective procedure. And then, just from a longer term perspective, 2020 and 2021, it's really going to be all about these kind of macro factors. There are some obviously encouraging things happening from more of a fundamental perspective. The biggest thing I guess I would highlight is just this software driven transformation of the industry. Everyone likes to talk about robotics. But robotics is really just part of the story here. I think what's happening is that software is enabling a number of different types of technologies that are really going to drive a wave of innovation in the industry. So you have robotics, as I mentioned, navigation, imaging systems are getting better. Smart implants, we're going to see Zimmer Biomet launch a smart implant this year. We're going to see more use of custom implants, I think. And then, as all these things gather more and more data, that data is going to be used to, with artificial intelligence, to help guide decisions. So, the surgeons, I think, will be getting recommendations from the navigation and robotic systems that, given this situation, you should do A, B, or C. They won't have to do that, but it'll help them make the right decision for that particular patient. So that's pretty much it for my presentation.
Mike, that was fantastic. Thank you so much. Our second Wall Street analyst, Shagun Singh, is an up-and-coming star analyst, and I have been looking for the opportunity to bring her into one of my seminars. Among her areas of focus is the spinal product suppliers. She is currently Vice President, Senior Research Analyst at Wells Fargo's medical device equity team, and over her 15 years covering medical technology, she has applied her skills at Stern Agee, Bank of Montreal. And Shagun, same question I asked Mike, what do you take away from 2020, and particularly for the spine side, how does 2021 shape up, do you think?
Great. Robin, I just want to make sure that you can see the presentation.
I see a bunch of horses and a covered wagon.
Okay, great. Well, good afternoon, everyone. I'm Shagun Singh, Senior Research Analyst and part of the medical device team at Wells Fargo. I first want to thank Robin for the invitation to speak here amongst some, pretty prominent speakers. My topic today is going to be focused on the spine market, and my goal is to provide an overview of 2020 and also a 2021 forecast. So let's start with 2020. I think COVID-19 pandemic was the key theme in 2020. The worldwide spine market, based on our estimates and our math here, declined about 9% in Q1, and that accelerated to about 28% year over year in Q2. The trends in US and international regions were fairly similar in the first half of 20. I would say slightly greater impact outside the US in Q1, and then slightly greater impact in the US in Q2. The worldwide spine market rebounded sharply in Q3. And we saw the rebound, it was sharper in the US than international. US rebounded to growth of about 3%, driven by a notable backlog. And international also rebounded for the spine market, but it was still in the negative territory, down about 50 basis points year over year. Spine market growth was impacted by accelerating COVID headwinds in Q4. We've had a number of companies pre-announced this week, so it does seem that the COVID headwinds accelerated through year-end 2020. And although the backlog continued to be cleared, at least initially in the quarter, hospital and surgeons were better prepared versus early in the pandemic. COVID cases spiked in the second half, especially through December and the last 2 weeks of December, when people see a lot of stocking orders. It seems like that did not occur, and there was a localized impact. Moving to the next slide, I think there were some very important lessons learned in 2020, and some of them may have already been mentioned. I think the number one lesson learned was that spine is resilient. It was really among the first procedures to return as the recovery began, and it was not just in orthopedics. We also learned that it was, spine has a very high pain burden, which creates an incentive for patients to return. And it is also a highly profitable procedure, which creates an incentive for hospitals and surgeons to really work to bring volumes back up. The second key lesson I think we learned in 2020 was that hospitals and surgeons, they needed to be better equipped to manage future headwinds. And what we have seen based on commentary from a couple of hospital companies is that they have expanded capacity. Resources can now be reallocated more quickly to perform profitable elective procedures safely. And I think the third key lesson learned in 2020, which I think is probably the most significant one, is that there has been a notable shift in focus on efficiency. I think hospitals and surgeons are asking, how can we be more efficient? And we did see, a lot of remote activity pick up. So we know that education, training, proctoring, is efficient using remote technology today. But I think there is a second level to it, and hospitals and surgeons, companies are really asking, what technologies can we adopt to make the procedure more efficient? And robotics could be one of it, but I think there are a number of ways to get there. So this shift in focus on efficiency, I would say, is the key as we think about the future of the spine market. In terms of the headwinds and tailwinds for 2020, I would say with respect to the headwinds, they were mostly COVID related, and the material headwinds, are largely behind us. We have seen some product delays as companies reallocated resources. We've seen hiring freeze. We've seen, where we have not seen hiring freeze, we have at least seen some kind of impact on, typical hiring trends. And there has been a significant margin implication as a result of COVID, because companies had to match expenses to revenue growth. In terms of tailwinds, I would say, spine market innovation and approvals continued throughout 2020, which is important even as a driver going forward. And I think a lot of the panelists here have mentioned that. Here I've listed a few approvals that went through, or the progress companies have been making on the innovation side. The other tailwind I would say is that M&A continued, but it was definitely smaller and few in number. Medtronic purchased Medicrea, Alphatec purchased EOS Imaging, or at least they've announced a new agreement. Surgalign purchase of Hollow Surgical. So I think M&A continued, which is positive. I would say pricing was relatively stable in 2020, which is a bit surprising, but that's what we've heard so far. And recruitment actually did continue at some companies, for example, Globus. Looking ahead, how do we think about 2021? I think there are a few key takeaways. Firstly, we expect the global spine market to deliver double-digit growth in 2021, driven by the COVID-related backlog. So last year's backlog, by our math, equates to about 10% of spine companies' 2019 sales. And we think that this backlog will continue to build into 2020 until we approach normalization. The backlog is not fully reflected in our estimates, but and also we think that maybe a tailwind in 2022, given capacity constraints this year. So we may not be able to get to all the procedures this year. Our current estimate is for 12.5% global spine growth in 2021. And I think there are risks to that as well, which is, the duration and of the impact of COVID in 2021, and also the vaccine rollout. The other key takeaway, I guess, looking at 2021 and our forecast is that, we would expect M&A to accelerate. Most companies maintained a pretty conservative balance sheet in 2020, and we know that the cost of funding is low. Spine remains an important vertical for several large companies, and consolidation of smaller players is likely to continue. We've talked about vendor consolidation and a fragmented spine market, I think earlier in this presentation, in this talk as well. And then I guess the other forecast or takeaway for 2021 is that we expect a focus on efficiency, and this is likely to drive differentiated growth in spine from a company perspective. I think Mike Matson mentioned smart implants, but I think there are other ways to get there as well. I think we mentioned robotics as well earlier in the presentation. And then we do expect a friendly FDA overall. So what are we most excited about with respect to spine market in 2021 and beyond? I think, I'm most excited about enabling technologies that can offer, either procedural integration, if you think about enhanced imaging, navigation, or robotics, and then artificial intelligence, I think that has a key role to play, in 2021 and beyond, as we are thinking about differentiated growth for spine companies. And overall, I would say, technologies that really lay the foundation for a future in individualized patient care, that can make the procedures ultimately safer, outcomes more reliable, and prevent costly revision surgeries. So with that, I'll pass it back to Robert.
Thank you very much, Shagun. That was wonderful. Okay, I'm going to share my screen now. And I'm going to make a couple comments on my side, and then we'll go into a panel discussion. As a publisher in orthopedics with about 300,000 readers in our industry annually, I could just start it here. With about 300,000 readers and 5 separate platforms, we rode that roller coaster along with our orthopedic surgeon audience and our suppliers. Our business, the publishing business, really lives or dies on our ability to create and hold an audience. And we have 2 principal audiences. We have the physician audience, and we have the executives who run companies and supply products to physicians. We also attract about 20,000 patients every month, and we have a small but loyal investor Wall Street crowd. Here's what we learned in 2020. First of all, we had to adapt to the subject matter. One of the things we did, and Lowry Barnes was really a key part of this, is within 2 hours of AAOS canceling, we began to organize content both in our publishing side, and we began to move into webinars where we addressed some of the key questions that physicians had, how to get back to surgery in the midst of COVID-19 and so forth. We had to find new ways of engaging the audience, and through the year, we ended up doing more than 30 of these kind of educational webinars, spine meetings, large joint meetings, master classes. Zoom and webinars became the new way to interact with physician audiences. We engaged more than 3,000 surgeons, and in the process, discovered some new skill sets and innovative ways to educate and to lift up our industry. So based on what we learned last year here at Orthopedics This Week, we've got 3 initiatives this year which represent a change from what we've done in the past as a response to what happened in 2020. Our first one is what we call micro broadcasting. As we did 30 meetings last year, we're going to do pretty much the same number of meetings this year. We partnered with Allegheny Health Network. We're doing 10 programs this year. 3 of them are going to be, much like this masterclass, are going to be bringing in experts to talk about surgical artificial intelligence, robotics, machine learning, recovering spine, large joints, and sports medicine. We're also organizing a program called The Pitch, and this is where medical product, service, and pharma and biologic entrepreneurs meet investors. It's kind of like Shark Tank, only more about helping companies, young companies, entrepreneurial companies, grow and get connected. And we are going to start this program in May. We also changed how we engage surgeons. In the absence of in-person meetings, we created a key opinion leader driven digital product launch program. And go to our website, you can check out what we did with Theracell, with Frank Phillips and Neil Anand, and you'll see what I'm talking about. And lastly, we changed how we present supplier advertising and information. We now are launching as of February 1st, what we call billboard banners that really, and they include video, that really have a very powerful, they increase engagement by about 300%. And we also launched something called content sponsorship. So beginning in February, we're going to be giving all of our suppliers and advertisers new ways of communicating with their audience. So with that, I think we're ready to go to our panel discussion, and we have 5 questions for our panel. And I'm going to start with, and actually I'm going to throw this up for jump ball. Will the new EU regulations have an impact on your business activities in Europe? I don't know, Janice, maybe you're the right person to start with, but other folks can jump in as well. So will the new EU regulations have an impact on orthopedic business activities in Europe?
I would say resounding yes. What I see already is it's changing where clients go to do their pilot work. It's changing the overall strategy of which market is first. And I think we will see more multinational studies trying to kill two birds with one stone, which has not been the way of most of my clients in the past. So I think it will have profound effects, seeing it through my lens of the FDA. And so I defer to others on what the broader business impacts would be, but I see it already.
I think that's exactly the right answer. I'm going to move quickly to the next question. Now, with the demand for outpatient surgery rising, will we see a change in the certificate of need regulations allowing for these centers to be built? And will there be, funding necessary to build and equip these facilities? Lowry, do you want to tackle that one?
Sure. I think we'll see certificate of need challenged in many states. And as you know, these are state laws, state regs, but rest assured that the hospitals who currently have those CONs are going to put up a significant fight to keep that business in the outpatient department of their hospital rather than in ASCs. So how that ends up, time will tell, and it'll probably be a different answer in different states. And I'm sorry, the second part of the question was?
Will funding be necessary to build and equip these facilities?
There'll be plenty of funding. Everybody will be happy to help fund them.
That is actually, we're going to stop on that. That's a great note to end on for that question. The next question is going to be for both Mike Mogul and Mark Viscogliosi. Mike Mogul, you first. Here's the question. Is there an opportunity for med device focused third-party logistics providers, med device focused third-party logistics providers, to emerge as a viable alternative to manage logistics internally for SME med device manufacturers to help bear the risk burden of uncertain elective procedure volumes and uncertain warehouse employee health challenges, COVID, of course. Mike Mogul, you want to tackle that first, and then after you?
Sure. I think simply put, especially in a cash-constrained environment, we want to focus on the things that the companies do well and need to do well. And logistics is typically not something a little startup with a great product needs to do well. And there are good third-party providers like, say, GMLX that really can do that work for the companies, and companies can focus on the things that are going to be important as they grow. So yes.
Mark?
Good answer, absolutely.
Okay, one final question, and this is going to go to both of our Wall Street analysts. And we have AAOS is planning their meeting for the end of August. I think NAS is the end of September. I may be a little off about that. And this is actually a little bit of a trick question, because how you answer this will also give a clue as when you think things will be getting near to normal. Not all the way there, but close enough. Will you be planning to attend either one of those meetings? Mike, you go first.
Well, it depends. I mean, tentatively I would say yes, but I'm not booking my flights anytime soon, and I have to get the approval of my wife. So,
okay, Shagun.
Well, I would say that AAOS and NAS are, they are very important meetings which we attend every year. This year, hopefully we can attend at least NAS in person. I don't know about AAOS; it's earlier in the year. But hopefully we can attend it in person. If not, then we'll definitely be catching all the presentations and everything, at least virtually. But hopefully it'll be in person.
Well, I promised that we would be done at the end of the, so I'm sharing my screen. And I'm going to just end with this quick item. Hold on, go to the very last one. There we go. I would point out that in 1918, when that pandemic finally ended, that was the beginning of what was known as the Roaring 20s. I do think that there is a very strong latent demand for us to get back to these in-person meetings, to reconnect, to engage, to do business. I think once that it can happen, whether it's this fall or early winter, the minute that occurs, and I'm looking particularly at AOS, I think that is going to be, that'll unleash this latent demand. And I do think perhaps the fourth quarter of 2021 and 2022, assuming the pandemic is under some form of control, we will see an explosion of business and connections, and we could be heading into 100 years later, our own version of the Roaring 20s. So on that hopefully optimistic note, I want to thank everybody for attending. Please, everyone, stay safe. And I look forward to seeing you at our next meeting. And gentlemen and gentlewomen, you were phenomenal, and have a good rest of the day. Thank you.
Thank you much.
Thanks, Robin. Thanks, everyone.
Thank you, Robin.